What is Ankyloglossia? So basically, Ankyloglossia, or which is called as the tongue tie, is a condition in which an unusually short band of tissue, which is called the lingual frenulum, remains attached to the floor of the mouth. So ideally, it should not be attached to the floor of the mouth, and when it is called this condition called the Ankyloglossia. So now we should know what are the symptoms or how can we find out that any child has ankyloglossia. If there is a difficulty latching when breastfeeding or breastfeeding for extended periods of time or when there is constant hunger or there is trouble gaining weight or there is a sound while the baby is feeding. So now, what is the genetics behind ankyloglossia? We should be knowing that there are two main genes that are there, that is TBX22 gene and CPX gene expression. So if the TBX22 gene has a mutation, it can cause ankyloglossia, and if the CPX gene is not expressed, it can lead to ankyloglossia. So now that we know the basics of ankyloglossia, we should also know what are its causes other than the genetic cause. So the other causes are the frenulum or the band of the tissue fails to separate from the tongue before the birth. So it is a developmental issue. Last but not the least, we should know how to treat this. So for infants and young children who don't have a problem with feeding, swallowing or speaking, they may not need any treatment. Another thing is, if the child has trouble feeding, their surgery can be done in which they cut their lingual frenulum, which is called a frenectomy. So this surgery is a minor surgery that can be done and the baby can easily feed.